the best part is when we have patients that we can help. The frustrating part is when we have patients that we can't help. We can't help with surgery. They can get traditional chemotherapy, but there are still patients that we can't help. And so the science allows me to try to think of what else can we do. And I was working with a professor and I got involved in cancer research. And actually the field that I was involved in is something that I've been working in the past 30 years. It's called tumor angiogenesis. And I was really fascinated by that because it's a concept where the tumors require a blood supply to grow, and they actually release proteins and cause blood vessels to converge upon the tumor. And when that happens, the tumor can grow and metastasize. I was always very interested in science and molecular biology, but I wanted a career in medicine because I wanted to understand diseases and have the patient contact. Personal family history of some very close family members that have breast cancer, and that happened while I was working in the lab at Harvard with Judah Folkman. And at that time, there was a drug that was being developed, and I decided that I wanted to look at it to see if it worked in breast cancer. And that was really the first time I got involved in breast cancer research, had the family experience. And then as I went back into my residency, I found that I really liked working with women. I've always been very interested in women's health, and so it really combined a lot of my interests. I spent 3 years in his lab, which was the most phenomenal experience because he was so inspiring. We always felt like we were so close to having a cure for cancer. He was a great role model for me. He had the hardest work ethic of anyone I've ever worked with, 7 days a week, late nights, and he always gave us this feeling of an urgency that there were people that were dying and what we were doing was really important. What was unique about this position is what they wanted was a breast surgeon who wants to do basic science. And that was exactly what I wanted to do. And I came down here and my husband and I fell in love with the place. We fell in love with the university. So much of it has to do with the people that work here. The physicians that I work with in our breast group, the medical oncologists, radiologists, radiation oncologists, all have the same focus of excellent patient care and trying to do research to improve the field. When I came here in 2001, I started to work with Cam Patterson, who is a cardiologist here and very renowned in the field of angiogenesis. And the question that we wanted to ask is, are there other angiogenesis factors that we don't know about? And it turns out, through years of research, we found that some of these genes actually were potent stimulators of blood vessel growth, are expressed in a wide variety of tumors, and we have now developed drugs, or a drug that blocks the function of these new angiogenesis factors, and we found that it actually inhibits tumor growth in animal models. It's just a really wonderful collaborative environment. I can pick up the phone, call someone, say who is the expert in a certain area, for example in pharmacology, find an expert, and they are extremely willing to collaborate. So I love to work with people that feel the same way that I do.